is supposed to work for the people, not against the people. And this president has shown us what a president looks like, acts like, speaks like, and does when he doesn't give a shit about.
A first-time congressman just walked into a budget committee hearing and systematically dismantled 10 years of healthcare talking points in under 5 minutes, using nothing but the other side's own record. Who signed it? Who wrote it? Who let it expire? And the Democrats in that room had no response. Stay until the end, because the part about where your insurance money actually goes will change how you see this entire debate. Like and subscribe right now. This is the kind of breakdown that disappears fast.
If you really want affordable health care insurance and you want the system to be easy to handle, then recognize the government should do its job on behalf of the people of this country. And we should have universal health care known as Medicare for all, and then we wouldn't have this problem. Mr. Roy, let me ask you a question. Are you not insured because you're so wealthy that you don't need to be insured?
Oh, I'm so appreciative of this question, ma'am, because the reason I'm not insured at the moment is because I'm in between jobs in terms of W-2. And I actually am on the board of a company called Crowd Health that provides an alternative to health insurance that is far less expensive than what I would be able to buy on the Affordable Care Act insurance marketplaces,
So then,
which
all
I
right,
find,
fine. I got the
so I
answer to
saved
your
money by actually not being
you have
insured.
access to health care.
We all have access to
And
health
at the end of the day, everything this administration has done has accrued to the wealthy, the very wealthy, the super wealthy, and has been done so at the need of those who are most in need. This government is supposed to work for the people, not against the people. And this president has shown us what a president looks like, acts like, speaks like, and does when he doesn't give a shit about this country. I yield back.
Thank you. The chair now recognizes the birthday boy from North Carolina, Mr. McDowell.
Thank you, Chairman. I actually have a question for you, and I just want to make sure that I'm in the right place. This is the Budget Committee, correct? It's not the Irony Committee?
This is the Budget Committee, correct?
That's good to know, because it's incredible to me, the irony that my colleagues across the aisle are trying to paint this as a problem that we caused. My 2-year-old, when she breaks something, she doesn't come to me and say, Daddy, why did you break this? Fix it. She comes up and says, I broke this. We have to fix it. They broke this, and we now have to fix it. So, Mr. White, I have some questions for you. Who was the president that signed the Affordable Care Act? Was it Donald Trump?
It was President Obama.
Interesting. Who was in power that drafted that legislation? Was it Republicans?
It was Democrats.
Interesting. The expiration date of the COVID-era tax credits that were put into law to expire when they did, was that done by Republicans or Democrats?
Twice by Democrats.
Who was the president that signed those? Was it Donald Trump?
It was not. It was Barack Obama.
How about that?
Joe Biden.
Yeah, how about that? Do you believe that something that requires so many subsidies to function actually works?
Absolutely not.
So over the past 10 years, we've heard this stat a couple times today, but over the past 10 years, healthcare spending on the federal level has doubled from $937 billion to $1.8 trillion. Does that appear to have helped that industry, or does it appear to have helped the folks that I represent in North Carolina?
What we see in the market is the doubling of costs have generally benefited the large players in the system, whether that's a hospital or an insurer, and you can see that very clearly in their stock prices.
When you find out that your insurance premium has increased, does Congress set those rates, or do the insurance companies set those rates?
The insurance companies do.
Interesting. And when hospitals and insurance companies negotiate the rates that they pay each other, does that process involve Congress in any way?
It does not.
How about that? I'm not here to paint anyone as the victim, whether it be private equity, whether it be the healthcare industry, because they're just operating under the rules that my colleagues across the aisle put on them. I would call them handcuffs, not even rules, because they now have to try to make money somehow. And they have appeared to have found that the only way to do that is through vertical and horizontal consolidation. But when you are a private equity firm that owns physician groups, because we've seen that continue to increase. Does a private equity firm care more about me getting cheap, inexpensive care, or do they care more about a profit?
They care about profits, but also delivering those services efficiently to
Sure.
lower costs and make better margin.
Yeah, and so what I hear today is my colleagues across the aisle trying to paint us as the people that wrote and then our president signed the Affordable Care Act. We have learned today that is not actually true. We have been told that all of the problems with rising healthcare costs are at the feet of Republicans, and I cannot tell you just how simply untrue that is. And it's really interesting to me that my colleagues they continue to speak in hyperbole and just spew irony to try to make this a problem that was caused by Republicans, because it's not. It is not. Everyone, our insurance costs went up. Going to the doctor costs more. And it is all because of what was caused by the Affordable Care Act.
Addison McDowell is a first-time representative out of North Carolina. He has been in Congress for 5 minutes by Washington standards, and he just delivered one of the cleaner dissections of the American healthcare argument that chamber has seen in years. Not because he yelled, not because he performed, but because he came in with a list of questions that had only one honest answer, and he made his colleagues across the aisle answer every single one of them on the record. Here is what actually happened in that room, and why it matters more than most people realize. The Democrat side of the committee opened by doing what they always do on healthcare: frame the entire conversation as a crisis caused by the current administration, demand universal coverage as the only moral solution, and exit the argument before anyone can examine the foundation it is built on. That is a strategy, not a policy position, and McDowell recognized it immediately. So he asked the witness a simple series of questions. Who signed the Affordable Care Act? Not Trump. Who wrote it? Not Republicans. The expiration of the pandemic-era tax credits that are now causing coverage gaps. Who put those expiration dates in the law? And who signed them? The answer, twice over, was the same party that is now standing in that hearing room pointing fingers. That is not a partisan attack. That is a paper trail. And it matters because the entire framing of the healthcare debate in this country depends on the public not following that trail. Now here's the part that deserves more attention than it typically gets. Federal healthcare spending has doubled in the last decade, from just under $1 trillion to nearly $2 trillion. That is not a rounding error. That is not inflation. That is a fundamental structural failure. And the question McDowell asked, whether that doubling of spending actually helped the people who need affordable care or whether it helped the large institutional players, was answered honestly by the witness. It helped the institutions. You can see it in hospital stock prices. You can see it in insurer profit margins. The people paying the premiums are not the ones who benefited from that flood of federal money. This is the part that gets lost in the noise every single time this debate happens. Congress does not set your insurance premium. Insurance companies do. Congress does not sit in the room when hospitals and insurers negotiate the rates they charge each other. That negotiation happens entirely outside of the legislative process. So when your premium goes up, and it has, for essentially everyone, the entity responsible for that number is not a politician. It is a boardroom. And the policy environment that gave that boardroom its power was built over the last 15 years by the same people demanding more government involvement as a solution. The crowd health situation is worth addressing because it reflects something real. The congressman is not insured through a traditional carrier. He uses a cost-sharing alternative that is significantly less expensive than what the ACA marketplace offers him. That is a data point, not a talking point. When a sitting member of Congress finds that opting out of the regulated insurance system saves him money, that is a system telling you something. It is telling you that the product being sold in that marketplace is not priced to serve a buyer. It is priced to sustain the structure around it. The deeper issue McDowell is pointing at, even if he did not say it in exactly these words, is that the entire architecture of American healthcare is built around the employer-based model. Your best coverage comes through your job. The moment you step outside that system, the price of everything goes up dramatically and the quality of your options goes down. The ACA promised to fix that gap. It did not. In many cases, it widened it. And the people who bear the cost of that failure are not the people in that hearing room. They are the small business owner, the independent contractor, the person between jobs trying to figure out how to cover family on the open market. Accountability is the word McDowell kept returning to, and it is the right one. Not blame, not politics. Accountability. His analogy about a child owning a mistake rather than deflecting it was simple, but it was exact. The structure of the political incentive in Washington rewards deflection. It rewards complexity. The more complicated the system, the harder it is to trace the failure back to a specific decision made by a specific person at a specific time. That complexity is not accidental. What McDowell did in that hearing was strip away the complexity. He reduced 10 years of healthcare policy to a series of factual questions with documented answers. And in doing so, he made the most important point of the entire debate without ever having to raise his voice. The problems you are living with right now, the premiums, the deductibles, the surprise bills, the consolidation of hospital systems, the private equity ownership of your doctor's practice, none of that came from nowhere. It came from a specific set of policy decisions. And those decisions have a record. That record is public, and it belongs to the people who are now in that room demanding that you trust them with more authority over the same system. The contrast in that hearing tells you something about where each party currently stands on this issue. One side came in with emotion and hyperbole and yielded back without a solution. The other came in with a timeline, a witness, and a set of questions that nobody in that room could honestly answer any other way than they did. That is what accountability in a committee hearing looks like. And it is rare enough that when you see it, it is worth paying attention to.